series of podcasts marking the Laura Crane Youth Cancer Trust 25th anniversary that will showcase the work of the Trust and highlight some important collaborators. I'm the charity's fundraising manager, Helen Merville, and I'm joined today by Trustee Emily Valley and Dr Nick Georgopoulos, another charity trustee, who is going to be talking about the research that the Trust has been funding at the University of Huddersfield over recent years. Welcome, Nick.
Thank you.
We'll jump straight in. You're leading on the research at the University of Huddersfield. So can you tell us a bit more about the work that you're doing there and how it's set to become a big breakthrough in cancer treatments?
Sure. Our main research interest at the university is to understand how cells in the body change as they turn from normal cells into tumor cells. How do they change their behavior? How do they react to signals that they receive in the body? One of our main research interests is relating to cell death, because in the body, if cells go wrong, it's one very important function of the body to instruct them to die for the greater good. If some cells have gone wrong, if they're becoming malignant, you want to eliminate them. For quite a few years now, we have been working on cell death, and particularly a specific protein, which is known as CD40. This protein, we discovered, is present both on normal cells of the body as well as tumor cells. What we discovered a few years back was that if you activate this protein, think of it as turning on a switch, it transmits inside cells of the body a signal to instruct them to die. However, what is fascinating is that when CD40 is activated, it can trigger cell death specifically in tumor cells, but not normal cells. This is an incredible property because it has important implications for therapy. What you want to do is to take advantage of this property. And we spend quite a bit of time trying to understand how CD40 does this and how it does it so well. And it was only a few years ago when we understood quite well how it can specifically kill tumor cells while sparing normal cells. Obviously, when someone thinks of cancer therapy, we think of classical therapies, such as chemotherapy, for instance. I guess the main thing to understand here is that a treatment like chemotherapy involves the use of very toxic drugs, and it can work very well. However, these drugs cannot discriminate between normal cells and tumor cells. They're very good at being toxic. They're very good at killing the very rapidly dividing tumor cells, but they cannot tell the difference between a normal and a tumor cell if the normal cell is also relatively rapidly dividing. Hence why you get side effects. And the most obvious side effect being, for example, hair loss. But there are also other side effects which involve affecting nerves, the limbs in the body, and so on and so on. Our ability to use CD40 to kill tumor cells is known as a different type of therapy. It's a targeted therapy. And as the name implies, it means that you are specifically trying to activate this special receptor on the tumor cells to kill them specifically. So if we can use that in the clinic, the aim is to be able to eliminate tumor cells without these very obvious and strong side effects that classical therapies have.
Thanks, Nick. So eliminating side effects of cancer treatment has always been a big challenge. They obviously have a massive impact on cancer patients, for example, the hair loss. You've obviously mentioned about the cancer treatments potentially won't have any side effects. Can you provide a little bit more detail about that?
Yes, of course. Classical chemotherapy drugs are very good at what they do. They're very, very toxic, but as many people know, they can't discriminate between normal, rapidly dividing cells and tumor cells. The thing about a treatment like the treatment we're trying to create with CD40 is that the signal you want to transmit into these cells to instruct them to die will only be delivered to these cells because they are the cells that have the receptor present on them. And in general, targeted therapies like the one we are developing have shown in the clinic that they will not have the very severe side effects that chemotherapy has. The most classical, obviously, being hair loss. Other side effects that cancer patients will experience are severe illness, all sorts of different neuropathic problems, meaning problems relating to nerves, sensation, discomfort, and for example, unlike say hair loss, these nerve-relating problems could actually be long-term, and even some drugs cause toxicity to the heart. So, so although chemotherapy drugs are very good, they can have long-term side effects. But a targeted therapy like activation of CD40, as well as other targeted therapies that are being developed clinically at the moment, are far more specific. The side effects will be very minor. For instance, during the therapy, someone might develop some fever, but that's very, very normal. And that is the main advantage of a therapeutic like this, that in simple terms, it's not a hit with a hammer approach, as chemotherapy really is. It works, but it's hitting with a hammer. We want a magic targeted bullet. That's the idea.
That all sounds fantastic, Nick. So what's next for the research? What's the next stage?
So what is next for us, what we have managed to do, thanks to the funding from the Laura Crane Trust, has been to specifically work on trying to understand how CD40 can potentially target the tumor cells in cancers that are more specific to young adults and teenagers. And what we have shown recently is that CD40 can actually target these cells. It can induce death in these cells. And very interestingly, what we found is that we can combine our CD40 therapy with other existing targeted therapies. And when we combine them together, we found a very, very effective combination that was able to eliminate these cells in the lab, which is really, really interesting and fascinating. So in principle, we have a very, very promising tool in our hands. But as it happens, doing this in the lab is one thing. Now you need to be able to deliver that in the clinic. And before you do that, you have to do all the preclinical work that is required to show that this is safe and it should be able to be delivered in patients before you do your proof of concept, as we call it, study in patients. So what we're working on doing is we have shown, we have done a lot of work to show that this works, how it works. So we've covered that aspect. Now we are working on developing this in such a way so we can push its use in the clinic as soon as possible.
That's just fantastic. Thank you so much, Nick.
No
I feel like I've got a greater understanding of the research as well, listening to your talk today, and how exciting that it's not just immediate side effects, but long-term side effects, which we all know is a massive problem for all age patients, but certainly our young cancer patients. That's wonderful. Thank you, Nick. Thank you also, Emily. Look out for more video podcasts from the charity. And if you would like to find out more about the work, take a look around our website or ask a member of the team. Thank you.
Thank you.
Thank you very much.